Welcome to this unit on governance of the public sector. By the end of this unit, you will be able to describe the role and need for governance of AI in the public sector. Assessing whether AI is necessary and appropriate for use in the public sector. For any use of AI by health professionals, governments must assess whether an AI technology is necessary and appropriate for the intended use, can be used according to relevant laws. Requiring ministries of health, public and private healthcare providers to observe legal and ethical standards in the procurement of AI can encourage appropriate design of AI technologies and provide a safeguard against harm. In India, the government's internal think tank, Niti Aayog, has proposed an ethics committee to review the procurement, development, and implementation of AI in the public sector. The UK government has established an analytical framework for use of AI. It includes whether the available data contains the required information, if it is ethical and safe to use the data, and consistent with the government's data ethics framework, if there are sufficient data for training AI, whether the task is too large or repetitive for a human to undertake without difficulty, and whether AI will provide information that a team could use to achieve real-world outcomes. Accountability through transparency and participation. Governments are increasingly required to disclose the use of algorithms in services and operations in order to promote accountability for the use of AI. For example, by informing a person that they are interacting with an AI and not a human. Many data protection laws require that decisions cannot be solely taken by automated systems, and use of automated decision-making is prevented in certain contexts. In France, the government is required to provide a general explanation of how any algorithm it uses functions, personalized explanations of decisions used by algorithms, justification for decisions, publication of source code, and other documentation about the algorithms. There is growing expectation that governments will be transparent about their use of AI, including whether they are investing in AI, engaged in partnerships with companies, or developing AI independently in state-owned enterprises or government agencies. It is also expected that governments will be transparent about any harm caused by use of AI and the measures taken to redress any harm. However, transparency may not be enough to ensure that government use of algorithms will not result in undue harm, especially for marginalized communities and populations. Greater public participation and public debate by a wide range of stakeholders is necessary to ensure that decisions about the introduction of an AI system in healthcare and elsewhere are not taken only by civil servants and companies. Appropriate collection, stewardship, and use of data. The collection, storage, and use of data, according to ethical and legal standards, also apply to governments. Government use of data could be misused, for example through the sale or provision of data to private companies that violates the public trust, sharing data obtained or collected for healthcare purposes in other government programs, including enforcement of immigration laws or criminal justice. This undermines trust in the healthcare system and the willingness of individuals to provide data and use AI technologies that are intended to improve healthcare. Governments also face risks of bias in data that are collected for the development of AI for use in the public sector. Risks and opportunities in use of AI for provision of public services and social protection. Governments have used AI to provide public services, including assessment of whether an individual qualifies for certain services, known as the digital welfare state. Digital data and technologies are used to identify, monitor, or disqualify recipients of social welfare through automated processes that flag, analyze, and predict behavior. While some have championed this use of AI as a means of eliminating redundant and repetitive tasks, there is concern that the digital welfare state could undermine access to social services and welfare, and especially affect poor and marginalized populations. Therefore, it is critical that AI-powered social services are designed to support people rather than contribute to potential adverse effects for those in vulnerable situations. A United Nations Special Rapporteur on Extreme Poverty and Human Rights warned that the digital welfare state could become a digital dystopia, constricting budgets intended for the provision of services, limiting those who qualify for government services, creating new conditionality, and introducing new sanctions to discourage the use of services. The report also notes that administering a welfare state through a digital ecosystem can exacerbate inequality, as many poor and marginalized individuals do not have adequate access to online services. You have now completed Unit 6 of Module 7, Elements of a Framework for Governance of AI for Health. In the next unit, we will look at regulatory considerations.